Hello, this tutorial is a lead-in synoptic presentation of the module Communicating with Children, part of the intellectual output number 2 of the Erasmus Plus project SoftisPed Softskills for Children's Health, funded by the European Commission. The module Communicating with Children was developed by the project coordinator, the project team from the University of Medicine and Pharmacy of Tirgu, Mures, Romania. We consider that besides the theoretical content, the added value of the module is the number of videos and tutorials, both in English and Romanian, that illustrate the strategies employed in communicating with children. Each chapter provides reference to online resources, the link to the resource, and a brief description. The introduction develops on the organization of the hospital environment in a pediatric unit, types of wards, different equipment and amenities such as free Wi-Fi, TV, toys, playground, stress relievers and comfort kits or waiting lounges. Reference is made to the pediatric clinic number 1 in Tirgu Mureș, and there is a link to the video presentation of this clinic by Chief of Clinic Professor Oana Marginean. Her presentation features efforts to create a pleasant environment for the sick children, such as the Dream Garden, a small corner of nature arranged for the children in this clinic, and different activities that can make their stay in hospital a positive experience. The second part, Communicating with Children, underlines the basic principles set down by UNICEF, such as communication with children should be age-adapted, holistic, positive, strengths-based, and inclusive, using child-appropriate language, characters, stories, music, and humor. In communicating with small children, health professionals should use loving tones and simple language. They should adapt to the child's growing attention span and use lots of repetition, rhythm, song, and games. For children in their middle years, they should use strategies such as visual and auditory, humor, cognitive challenges as well. For teenagers, health professionals should talk respectfully and not didactically. So do not talk down. Use a lot of humor and creativity. Purvis addresses the communication challenges physicians may face when interacting with children, and the importance of applying the 4 E's: engagement, empathy, enlistment, and education, stressing the significance of verbal and non-verbal communication. In the medical field, it is especially important to give the child choices, that is, to empower the child. Therefore, to the extent possible, healthcare professionals should give the child some control of the examination. For example, a pediatrician may ask, "Do you want me to look at your eyes or your ears first?" Then they should keep the child informed. A running dialogue with a pediatric patient during the physical examination improves cooperation and helps alleviate anxiety. WAYS and the National Patient Safety Foundation propose several steps to improve communication with child patients through slowing the speech, spending a little additional time with the patient and family, sit rather than stand, listen rather than speak, use plain non-medical language. For example, you can say high blood pressure rather than hypertension, or heart doctor instead of cardiologist. Use analogies, pictures, review and repeat key points. Use teach back techniques and show me techniques. The next part of the tutorial focuses on strategies employed in pediatric communication, and the first to be dealt with is communicating through pictures, as they enhance understanding and recall. The University of Medicine and Pharmacy of Tirgu developed several tutorials here, such as What do you want to do today?, the tutorial Symptoms as Images, and Drawing What and How I Feel. The next communication strategy is games and ludic activities. Why should pediatricians use them? Because the unknown can cause fear and anxiety in both children and their parents, and play is a natural daily form of activity, so children do not associate it with stress and fear. The use of toys and dolls is a stress-reducing communication strategy through which focus is drawn on the message rather than on the fear and anxiety that the child patient is experiencing. Tutorials by University of Tirgu include the game The Toy is Sick and the game of dolls. The next strategy is stories. Stories are used in therapeutic interventions as they establish rapport with the child, assess the level of their fear and anxiety, explain procedures, and prepare for future procedures or treatment. The University of Tirgu developed the tutorial, the story, How to Handle Better the Pain. The next part of the module is dedicated to soft skills in communicating with children. It details on some of the most important soft skills that resulted from the research conducted in Intellectual Output Number 1. Soft skills which are likely to facilitate communication with children, and they include observation, active listening with its own sub-strategies such as beginning by inviting the patient or parent to tell their story of the disease, not interrupting, using non-verbal signs such as nodding, smiling, validation, which means that the pediatrician is explaining to the patient how they interpret what the patient had just said, reflection, which involves repeating a significant word or phrase that the patient had just said. Other soft skills dealt with in this part are use of simple language, empathy, patience, humor, solving problems and critical thinking, and last but not least, intercultural sensitivity, which draws attention to respecting the values of the patient's health beliefs and practices. The next part of the module is dedicated to teaching soft skills. Teaching soft skills does not necessarily involve special methods. Rather, teaching and learning methods and strategies involved in general doctor-patient communication can be applied. And the module refers to team-based learning, which is a learner-centered, instructor-directed strategy that incorporates class-based teamwork and assessment to enhance active learning and critical thinking. The next teaching strategy is the flipped classroom, which refers to an approach to teaching where the traditional class time and self-study activities are reversed or flipped. Students prepare for class by watching a pre-recorded lecture or undertaking assigned reading activities, followed by the lecture time being used for interactive discussion, problem solving, and other activities with the teacher. The next teaching strategy is role play, which is widely used as an educational method for learning about communication in medical education and is generally involved in the broader context of simulations. The yes-no scenarios is the next teaching method. Students are offered both the good and the bad solution to a problem. And also they can arrive at the good solution either inductively or deductively themselves, depending on the amount and autonomy they work with. The next teaching method is problem-based learning, where students work in small groups supported by a tutor. They initially explore a predetermined problem which contains triggers designed to evoke objectives, which are used to set the agenda for individual or group investigation and learning after the initial session. Subsequent group meetings permit students to monitor their achievements and to set further learning goals as required. The tutor's role is to offer support for learning and to help reach the expected outcomes. Reflective learning is the next teaching strategy, which is an important model of learning that is based on the principle of gaining knowledge and insight from the learner's own experience. And two concepts are developed here, that is reflection in action, that is during learning, and reflection on action, that is at the end of the experience. And the last teaching method explored here is simulations and models, which are tools for assessment of clinical performance in an environment closely resembling reality and imitating real clinical problems to rate the learner's performance on clinical problems that are difficult or maybe even impossible to evaluate effectively without harming a real patient. The next part of the module is dedicated to the presentation of 8 practical activities, lesson plans or scenarios, which can be used by trainers in their practical activity with students, with each lesson identifying the problems addressed, the soft skills involved, and the methods employed. We do hope that you will find both the theoretical and the practical content of the module useful, and you will be able to use it in your future practical activity with students in teaching communication and soft skills in pediatrics. Good luck!